essentially, in order to break an addictive pattern, to become unaddicted, 30 days of zero interaction with that substance, that person, etc.
Right.
Is that correct?
Yeah. And 30 days is, in my clinical experience, the average amount of time it takes for the brain to reset reward pathways, for dopamine transmission to regenerate itself. There's also a little bit of science that suggests that that's true. Some imaging studies showing that our brains are still in a dopamine deficit state 2 weeks after we've been using our drug. And then a study by Schuckett and Brown, which took a group of depressed men who also were addicted to alcohol, put them in a hospital where they had received no treatment for depression, but they had no access to alcohol in that time. And after 4 weeks, 80% of them no longer met criteria for major depression. So again, this idea that by depriving ourselves of this high dopamine, high reward substance or behavior, we allow our brains to regenerate its own dopamine for the balance to really equilibrate. And then we're in a place where we can sort of enjoy other things.
So I'd like to dissect out that 30 days a little more. So days 1 through 10, that 10 days is going to be miserable.
Right.
Anxiety, trouble sleeping, physical agitation, and to the point where maybe impulsive, angry. Should one expect all of that? Should the family members of people expect all of that?
Yeah. So what I say to patients, and it's a really important piece of this intervention, is that you will feel worse before you feel better. You'll feel worse for 2 weeks, but if you can make it through those first 2 weeks, the sun will start to come out in week 3. And by week 4, most people are feeling a whole lot better than they were before they stopped using their substance. So it's a hard thing. Like, you have to sign up for it. And I will say, obviously, there are people with addictions that are so severe that as long as they have access to their drug or behavior, they're not able to stop themselves. And that's why we have, higher levels of care or residential treatment. So this is not going to be for everybody, this intervention, but it's amazing how many people with really severe addictions to things like heroin, cocaine, very severe pornography addictions. I posit this, and I do it as an experiment. I said, let's try this experiment. I'm always amazed, number one, how many of them are willing, and number two, how many of them are actually able to do it. They are able to do it. And so that little nudge is sort of just what they need. And the carrot is, there's a better life out there for you, and you'll be able to taste it in a month. You really will be able to begin to see that you can feel better and that there's another way.
So the way you describe it seems like it's hard, but it's doable for most people, not everybody.
Right.
Well, then days 21 through 30, people are feeling better. The sun is starting to come out, as you mentioned, which translates in the narrative we've created here and supported by biology, that dopamine is starting to be released in response to the taste of a really good cup of coffee. I've seen a lot of people go through addiction and addiction treatment. I've spent a lot of time in those places, actually, looking at it, researching. I've got friends in that community. I'm close with that community. One thing I've seen over and over again, sadly, often in the same individuals, is they get sober from whatever. They're doing great. These are people with families. Discard your normal image of an addict and insert the most normal, typical, whatever, healthy person you can imagine, because a lot of these people you wouldn't know were addicts. And then all of a sudden, you get this call. So-and-so's back in jail. So-and-so's wife is going to leave him because he drank 2 bottles of wine and took a Xanax at 7 a.m., crashed his truck into a pole. He's got 2 beautiful kids. Like, how did this happen again? To the point where by the 4th and 5th time, people are just done. What sorts of things help other people that we know that are addicted? What really helps? And are there certain people for whom it's hopeless?
Yeah, so there are people who will die of their disease of addiction, and I think conceptualizing it as a disease is a helpful frame. There are other frames that we could use, but I do think, given the brain physiologic changes that occur with sustained heavy drug use and what we know happens to the brain, it is really reasonable to think of it as a brain disease. And for me, the real window of, let's say, being able to access my compassion around people who are repeat relapsers, even when their life is so much better, is to conceptualize this balance and the dopamine deficit state, and a balance tilted to the side of pain. And to imagine that for some people, after a month or 6 months or maybe even 6 years, others, their balance is still tipped to the side of pain. That on some level, that balance has lost its resilience and its ability to restore homeostasis.
It's almost like the hinge on that balance is messed up.
Exactly. And so, I mean, for someone who's never experienced addiction like yourself, maybe one way to conceptualize it is imagine that you had an itch somewhere on your body, okay? It was super, super itchy. You can go for, if you really focus, you could go for a pretty good amount of time not scratching it. But the moment you stopped focusing on not scratching it, you would scratch it. And maybe you do it while you were asleep. And that is what happens to people with severe addiction. That balance is essentially broken. Homeostasis does not get restored despite sustained abstinence. They're living with that constant specter of that pull. It never goes away. So let me say there are lots of people with addiction for whom that does go away, and it goes away at 4 weeks for many of them. But in severe cases, that's always there and it's lingering, and it's the moment when they're not focusing on not using, it's like a reflex. They fall back into it. It's not purposeful. It's not because they want to get high. It's not because they value using drugs more than they do their family. None of that. It's that really they cannot not do it when given the opportunity and that moment when they're not thinking about it, right? So just thinking about whatever the trigger is that we associate with drug use, or just thinking about drug use, can already release this anticipatory dopamine, this little mini spike. But here's the part that I think is really fascinating. That mini spike is followed by a mini deficit state. So it goes up and then it doesn't go back down to baseline. It goes below baseline tonic levels. And that's craving, right? So that anticipation is immediately followed by wanting the drug. And it's that dopamine deficit state that drives the motivation to go and get the drug. So many people talk about dopamine is not really about pleasure, but about wanting and about motivation. And so it is that deficit state that then drives the locomotion to get it. When people come to that realization about themselves, that they're most vulnerable when things are going well, that's really a valuable insight, because then they can put some, things in place or barriers in place or go to more meetings or whatever it is that they do, to protect themselves.